And this is Nancy Corser, who works with her husband, Ron Corser, and the name of our firm is Ron Corser and Associates. Tonight, helping us also is Elizabeth Fifield, and she's kind of behind the scenes here, but she is helping me with the technology because I'm one of the older folks in the team. And although I've been taking care of my Medicare clients and prospects for many years, some of the technology is still kind of new to me. So thank you very much for joining us, and thank you for your patience. This evening's presentation will go for about an hour, and it truly is an educational seminar. Tonight, I will not talk about any specific companies or any particular plans, but my goal is to help you better understand the working parts and pieces of Medicare, to demystify the process because there is a lot of different moving parts, and to let you know that we're here to help in any way needed. As mentioned previously, I've been doing this now for almost 16 years. When I came aboard with my husband, it became abundantly clear to his clients, because he does the wealth retirement management side, that they were totally clueless and overwhelmed and needed a lot of help in terms of, what do I do? I'm 64 years old. I'm starting to think about Medicare, or I'm looking at retiring and I'm getting all this information in the mail about Medicare. So here we go. Wanted to let you know also that we do have material that I'm more than happy to email or mail to you. Just simply let Chris know that, and we'll make sure that it gets in your hands. Again, tonight's going to be fairly high level. We offer you a complimentary review at no charge. There never is a charge in terms of talking to us or meeting with us. Medicare is very adamant that a resource such as myself is just that. I'm an educational resource for you, to help you, to guide you. So for many of us, this is kind of where we're at in the whole process. If you're turning 65, you start getting bombarded with a lot of different information and people telling you to do this or not do that. And having a resource, somebody that's been doing this for a while, can be a real helping hand for you. We are meeting in person, or we're meeting via Zoom, or we're meeting via phone call. So whatever you're most convenient with. Again, tonight's presentation, very high level, more generic, but certainly can talk to you about your specific set of circumstances. A little bit more about me. I am an independent agent. That means I have access to a variety of different companies. I'm not locked into one particular company, and I'm very much about having a relationship to the degree that you would like one. I'm not a one and done kind of agent. I meet with anybody that wants to during open enrollment. It's the busiest time of the year for us, and we will do an annual review to make sure that you're well positioned for the next year. I represent Medicare Advantage plan companies. There's probably about 6 or 7. I represent about a dozen Medigap companies and the vast majority of prescription drug plans that are currently available. Know that regardless of who you work with, and I certainly hope you would want to work with me, we all have to certify once a year. Everybody that helps people with Medicare. There's a lot of training. There's a lot of government regulations that we have to be aware of. Lauren Kent's on vacation this week, and interestingly enough, I have been home most of the week due to the COVID-19. So somewhere along the line, I got exposed to it and immediately came home. And that's where I've been working, is in my basement for the last 8 or 9 days. But Lauren is my right-hand person. So should you decide to make an appointment or you have additional questions, she and I work very, very closely together. Here's the rest of our team. At the very far right is Beth, and again, she's kind of behind the scenes here. Next to her is Nolan, and Nolan is the other financial advisor, working hand in hand with my husband, Ron, there. And I'm the one in the middle that looks a little weary there. I think I should have my picture retaken. Next to me, and the lady in the stripe, is my sister. She works for us part-time. Again, we have my husband, Ron Corser, and then to his left, Lindsay, who does the sales support side for the wealth management, and then we've got Lauren on the very far left. Here's our agenda for this evening. Again, the goal is to make it simple. Should you want to do a repeat of this course, I do teach a course at Rockford Community Education several times a year. It's actually a 2-night course. We go for about an hour and a half each night, and we even get a little bit further into the weeds, a little bit more detail than what we're going to do tonight, but you're always welcome to participate in that as well. Never a charge. So, Introduction to Medicare, we'll start right there. This is a program that was introduced in 1965, and the president at the time was Lyndon Baines Johnson, and it was part of the Great Society. So many people were starting to retire, and they said, what am I going to do about my health insurance? My employer is no longer providing it. So they put together a program called Medicare. It has changed, not so much in terms of its AB, but it certainly has changed in terms of the premiums that are charged, as well as some of the out-of-pocket expense. So Medicare, 1965, been a program around for a long time. And I know that there are some changes that are being talked about with the new administration, and time will tell where that will ultimately end up. So I've been reading more and more on that, but nothing has been finalized. We're going to talk about Medicare enrollment. That's kind of important, especially if you're not collecting Social Security, because it is something you have to do yourself. We're going to talk about the moving parts of A, B, C, and D, costs and coverage, because Medicare isn't free. So not only are you going to pay a premium to the government for the plan itself and being a participant, but then you're also going to have out-of-pocket costs. Not totally unlike a group plan that you might be on today. And then we're going to talk about supplemental options, and this is where I provide the advice and the recommendations, and typically people would be talking about their specific needs and what they're looking for. And this is when I go out and say, okay, you might want to consider this company, or you might want to consider that plan. And then we're going to talk about the drug coverage, which is considered Part D of Medicare, and then some Q&A at the end. Chris, do we have any idea of how many people currently are either in Medicare? That would be one question. Or the other question could be, is there anybody that's on the webinar that hasn't turned 65 yet?
Well, we do have someone who is 59 and a half, and they have a question for you, Nancy.
Okay.
You might want to write this down or whatever.
Sure.
They have VA health coverage and expect to be going on Social Security, SSA disability soon.
Okay.
Will they be forced into Medicare, or will they be able to keep their VA health care? You might want to answer that either now or later or whenever it's appropriate.
Okay. Chances are, if they have 100% VA coverage, they can keep their VA coverage. I would almost have to get a few more details, because what I wouldn't want to have happen is to find out that they didn't want they didn't want to sign up for Part B and pay for it, and then find out down the road they were forced into a situation of where they didn't have Part B and now they had a giant penalty. So I'm going to say I got to take that one offline, Chris, because that one could be a little tricky without asking a few more questions. Okay.
Got it. Thank you, Nancy.
Absolutely. But I'm happy to do a little more research as needed. Okay, I'm going to keep going here. I'm going to assume that there are some people that haven't joined the ranks of Medicare. We've got people that will be turning 65 in the next couple of years. And we may even have people here that are still working that have already turned 65 and maybe done something. So we'll address that as well. So to continue. Also, keep in mind, this is Medicare and not Medicaid. So this is the government health program that most of us have worked at least 10 years or more for, and now have qualified for Part A, and then will become eligible for Part B. You do have to be a legal resident legal resident of the United States and have lived here for at least the last 5 years. And there are some people under 65 due to a disability that become eligible for Medicare. Typically, it's 25 months later. Or people of any age that might have end-stage renal or kidney failure. So those are the folks that become eligible. Here are the 4 parts of Medicare. Part A and Part B is referred to as traditional Medicare. This is where we first started 50-some years ago. Part A is the hospitalization, and Part B is the medical insurance. Within the last 15 years, we have added Part C. Part C is what we call a Medicare Advantage plan, and it's a type of add-on plan that replaces Part A and Part B and gives you even more. And we're going to go into more detail, but it is a government program that's overseen. And once a year, the plans change. So when we talk about the annual election period, which you hear all about on the TV, which runs from October through December, they're talking about the plan changes associated with a Medicare Advantage plan. So they're reaching out to people and letting them know that their plan is going to change and that they're going to have to make a decision of, do I stay in the same plan and take the changes, or do I want to make a change? Part D was introduced in 2006, and it is the prescription drug coverage. So again, we're going to talk in more detail about it, but there are 2 newer programs, C and D. They are overseen by the federal government. The players that participate, they are insurance companies. So those are the names like Priority Health and Blue Cross and WellCare for the Part D and SilverScript for the Part D, and so on and so forth. So that's where those carriers come into play. But they must follow all the guidelines of Medicare and Medicaid because they are the overseeing organization. So we'll come back to Part C and Part D. Part D, again, it can be renewed once a year. So those are the 2 that we really pay attention to during the open enrollment. But now we're going to go back to Part A and Part B because everybody has to start with Part A and Part B. So Part A, hospitalization, there is a lot of out-of-pocket expense. I'll go through that in a little bit of detail, but if you do want the worksheet for 2021, do let me know, because what you're also going to find in reference to Part B is that's where everybody has to pay a premium. And if you are a higher income beneficiary, you are going to pay more than the base premium. And again, that worksheet will show you that in a little bit more detail. Typically, you hear Part B is described as Medicare pays 80% and you pay 20%. So Part B has a co-insurance. Again, a lot like a group plan. You pay 20, the government pays 80%. Part A has actually got a deductible. So again, we'll come back to that in a moment. So people often say, well, do I have to do something to get enrolled, or how is this all going to work? Okay, so here's what happens. If you are currently collecting Social Security, and you can start that at age 62, and many people have, you will automatically be enrolled in Medicare. You will receive your card 3 to 4 months in advance of your birth month. Your enrollment then is taken care of in its entirety for you. That piece of it you can check right off the checklist. If you are still working and you have access to a group plan, either because of your employment or your spouse's employment, and there are 20 or more employees working for that company with that plan, you can decline Part B. And the reason you would decline it is there is a premium associated, and that premium this year is $148.50 per month per person. So if that's your situation, you would actually take your Medicare card, and on the back of it, you're going to decline. There's a little spot right there. You're going to check the box, you're going to sign it, and you're going to send it back. What will happen is they will reissue your card for the Part A only. and it will retain the original birth date that they put on your card. So the person that is not collecting Social Security must enroll online. But before we talk about that, here are the old cards and the new card. So on the far right there is the brand new card that you would actually receive in the mail. It has your name. It has the 11-digit alphanumeric number unique only to you. Previously, there was concern about using the Social Security number in the past for identity theft purposes. So about 2.5, almost 3 years ago, they finally were able to come up with a configuration that is now unique to you. So you will always have the same Medicare ID number, but you don't necessarily always have the same Part A and Part B. And here's what I mean by that. The Part A, generally speaking, for people turning 65, will reflect the first day of their birth month. So, for example, if you were born in 1955 and you turned 65 last year and you took your Medicare card, it would have a date of 4/1/2020. If you took Part B at the very same time, you would have the same date, 4/1/2020. So it doesn't matter whether your birth date is April 2 or April 29, they're always going to backdate it to the first of the month. The only time they don't give you the first of the month is if you're born on the first of the month, and then they will backdate it the prior month. So if somebody was born on April 1st, they're going to get March 1st as their effective date. If somebody does decline Part B, like I just described in this example here, when they were ready for their Part B, which could be months or years down the road, they would then get the date that they wanted their Part B to start. And we'll talk a little bit more about that, but you'd actually have 2 dates on your card. So for the person who says, but wait, I'm not collecting Social Security and I think I might want to evaluate my Medicare, and we get through that process together because we meet with a lot of people who we might even say, nope, stay on your group plan. Or we might say, look, this looks like another option for you. You don't have to sign up for it at the present time. So that's all part of the service that we provide for you. We want to make sure this is the right move for you. And if it is, we're going to help you with that. And if it isn't, we're going to make sure that you understand why you're postponing it, because what you don't want, and you get lots of information that seem to infer you're going to have a giant penalty. And we want to make sure that you know there's no penalty as long as you follow the guidelines. And that's what we uncovered together as it pertains to you. So again, Medicare enrollment for the person who says, yes, I do want my Medicare. They are going to actually have to go online. Now, we will help with the service. I don't know of any other agency that really does this portion of the process. For us, it's easy. For many of our clients, they're just thrilled to have somebody be able to help them here. So know that that is an offer that we would make to you as well. You would come into the office with your Social Security sign-on information. So more and more Social Security wants you to do things online. In fact, many organizations now do. So if you bring in your sign-on and your password, what we're going to do is we're going to help you on the website sign up for your Medicare. Now, the way that it works is there's a 7-month window, and I think that's on my next slide here. There it is. The 7-month window, this pertains to the person who has to enroll in Part A and Part B. So imagine your birth date here is in April, and you were born in 1957. We'll leave it with next year, okay? The person's thinking, okay, I might have to do something with my Medicare. So April next year, they're turning 65. They're thinking they might want it. If they pursue this, they can find themselves in the month of January. That's the 3 months before. So in January of next year, they would get online or they would come and see us. We would sign into Social Security with their passwords and so on, and we would walk them through the process. So you can sign in January, February, or March. So all you're doing is getting online into the system, and you are telling the system, I want my Part A and my Part B. It will not become effective until April 1st of next year. You will not get a bill for the Part B until that point in time. So it doesn't matter when you do it, they're giving you 90 days to pull it off. The sooner you do it, the sooner you get your card and all the other information that they're going to send you. So yes, you can wait the 3rd month. In this example, you could pull it off in March, but why if you didn't really need to? But they're going to give you a 90-day window to make that happen. Your birth month then in this example here is April. It would be effective the 1st day of the month. And then they actually give you 3 more months after your birthday. Sign up for Part A and Part B. All I would caution you here is it's not as logical as thinking that if I sign up in May, I would get June. They add some other numbers to it. So I'm not going to go through big explanation, but when I first got started, I thought, oh, well, this will be logical. We'll just say we applied in April, we get May. We applied in May, we get June. It doesn't work that way. So if you find yourself wanting to delay when you want things to start, there are some workarounds. I have contacts at Social Security that have guided me over the years so that we know kind of the ins and outs, because the initial enrollment period, you get one of them, and there's some things that you absolutely have to do with it that you can't bypass. So you got to make sure that you're within your 7 months if that's where you're at. Otherwise, it becomes a different kind of enrollment period. So make sure I covered everything here. And again, when we talk about the HSA, I know that there's some people that have a health savings account. Keep in mind, if you have any part of Medicare, whether you were automatically signed up for it because you're on Social Security or because now you want to take your Medicare, you may no longer contribute to the HSA. You can use the funds that you've set aside, but you may not continue to contribute. And that includes your employer as well. So you must stop. Now, I've had a few people forget to turn it off, okay? I do not think that the penalty is very sizable. In fact, some people have said they never even got a penalty, but I would just caution you, keep in mind any part of Medicare, Part A and or A and B, you will want to stop your HSA. Now, there are some people that sign up for Part A only. And these are the people that don't have an HSA and they work for an employer with 20 or more employees. And again, as we talked about going into the website, if that's your situation, and that's why it's advantageous to come and see us so you'll know what's what, is the government prefers you sign up for Part A even if you don't want Part B, because you are there in their system. And when it's time for you wanting your Part B, it's a whole lot easier if you already have your Medicare Part A. So there is no downside for Part A because it's a zero premium. The only downside is if you have an HSA, don't touch the Part A. And again, there's a workaround for that. Here are 3 of the enrollment periods. We have the initial enrollment period. This is when you're turning 65. If you take it, it's called your IEP. If you're still working, you bypass your IEP. You might sign up for Part A because you're working for a company with 20 or more, and that was all you had to do. When you get ready to retire, you will be granted what's called a special enrollment period by the government. Typically, this is when a person is losing their group health coverage, either by way of a spouse or because they themselves are retiring. So they might be 68 years old. They signed up for Part A and they're ready to call it quits. And now they want their Part B because now they're going to need their health insurance through Medicare. They don't have access to a retiree plan. They don't have access to VA benefits. They don't have access to anything other than all those years that they have contributed to Part A. So Part A of Medicare, the hospitalization, as long as you work 10 years or more, I should back up. Medicare is eligible for anyone 10 years or more in terms of working. As long as you're working, you're still paying into Part A for those that are out there working. That is the Medicare tax that comes out of your payroll check. So that's why it's a zero premium. But what it's not, and I just wanted to mention that as an aside here, and again, this is what we can send you, is the Medicare Part A does have a pretty sizable deductible, and it's almost $1,500 if you were admitted to the hospital. So in a few minutes, you're going to see why people do buy additional insurance to start to fill the gaps of what is out there under Part A, the hospitalization, as well as Part B, which has got that 20% co-insurance. So the other important time of the year is the annual election period. This runs from October 1st until December the 7th of every year. It's about a 7 or 8 week window. It allows you to make changes to either your Advantage plan, which is your Part C, or your Part D, which is your prescription drug plan. A lot of people will stay in the same plan. They don't need to do anything other than just allow it to roll over. The only word of caution is you don't want to do that too often, because if you don't review what's called the annual notice of change, you could be very surprised, because once the new year begins, you probably don't have a chance to make a change for another 12 months. So that's part of our service. We invite people in to review their plans either as a group. I have many clients in the same plan, different carriers, and we'll kind of all get together and we'll go through that plan and say, okay, these are the changes that were made. Any questions? Do you want to make a change? So on and so forth. Because some years they might add dental, or they might add an over-the-counter benefit, or they might add something new that you want to be aware of. That's also the value of working with an agent or working with an advisor like me, because I keep you informed. I'm not a one and done. I want to make sure that you know what your options are, and being independent, we can look at other companies. If you say, you know, that just didn't work at all this past year, let's look at somebody else. When we make a change during the annual election period, they're always effective January the 1st of the upcoming year. So we talked about that 7-month initial enrollment period. It only really applies to the person who wants to come aboard and enroll in Medicare Part A and Part B. So the general rule of thumb to emphasize here is, if you're turning 65, you need to know, do I need to do anything with my Medicare or do I not? If I am still working and there are 20 or more employees and I'm not on an HSA, you might want to sign up for Part A. If there are 20 or less and you don't have access to a spousal plan, okay, you do have to sign up for Medicare Part A and Part B. I get a lot of folks that will have access to the Office of Retirement Services through the teachers, through the state of Michigan. If you are no longer working and you've retired, that is what we call a retiree plan, and that does require that you sign up for Part B. So anybody that might have access to a retiree plan as a teacher or through some of the other big companies in the Western Michigan area, and there's a few retiree plans still left, you do have to sign up for Part A and Part B. It's got nothing to do with the quantity of 20. That 20 only applies to an active working member. So we will help with what's called the special enrollment period. This is when somebody comes to us and says, I remember that you told me I had to do something with these forms so that I could avoid any kind of penalty. So these forms come right from Social Security, and the first form goes to your employer, and the employer will fill it out. We generally say 45 to 60 days in advance of when you want your Part B to start. And they're going to indicate that you've been working for their company from this period to that period, and it will encompass the time that you turned 65. That way, there is no penalty. When the government gets that form and they see that you've been working 25 years and it happened to encompass when you turned 65, you had credible, valid coverage and did not have to sign up for Part B. The other form is the form that says, now I want my Part B to start. And again, for those people that signed up for their Part A, they pull out their Medicare Part A card. We start out with that Medicare ID number. We fill out the rest of the information. You sign it, and then both forms, completed forms, actually get mailed to the local Social Security office. So with the COVID being in place, the office there is still closed. They will take appointments on an exception basis only for really kind of the more complicated cases. They generally don't for this. They will schedule a telephone appointment. Now, I've even had a few clients say, I got my phone appointment, but I wanted my effective date of May, and I can't even get the appointment until May 15. They're scheduling like 3 to 4 weeks out. So what I have been told is that they will, in that example, backdate for that particular person. So the sooner you get working on this, the sooner you're going to get all the ducks in a row here. But the forms themselves, pretty easy to fill out. The employers, they go right to the HR department. They return it back to you. You make a copy, you send it to Social Security. And then before you know it, you can actually get back online to your Social Security account where we made all those changes with A and B and signed you up. And it will have a letter there that says you've been approved for your Part A and Part B, and it will have that 11-digit alphanumeric number. And then right after that, probably about a month later, you will get your Medicare card, a little paper card. And if you come into our office, we will laminate it for you if you would like. So here's just a little bit of insight into the premiums. I mentioned it earlier. There's that $148.50. So that's the base premium this year. It went up from $144.60. Anytime there's a cost of living increase, they can adjust the Part B base premium, and they did. It was slight. The cost of living increase, I think, was only like 1.2 or 1.3%, but it did go up slightly. And then we do have the income related adjustment. So if we have anybody out there who is making in excess of $750,000 filing jointly, keep in mind they look 2 years back at your income. So it's not based on the year prior, it's based on 2 years prior. So they're working right with the IRS. They're looking at your tax documents there. And if you filed jointly and your income was over $750 back in 2019, you will have a Part B premium of $504.90. And then the kicker is you also get to pay more for your Part D. And in that example, you would pay another $77.10. So when I do meet with people that are higher income beneficiaries, sometimes they don't know this, and this comes as a huge surprise. So there are some things that if you pay heed to it now and you've got a couple of years yet before you retire, work with your financial advisor or call us. But there are some strategies that you can put into place to try to lower that threshold for you, because there are 5 or 6 different thresholds in terms of the Part B premium. And maybe over the course of time, you can take yourself from the highest tier and move on down the road there to get it further down. That's what my husband Ron and I have tried to do over the years, is try to stay away from being too much the higher income beneficiary. So there are some strategies there.
Can I ask a question?
Sure.
Okay. Is there a time in your life after 65 that you have to sign up for Part B, regardless if you have other insurance available to you?
As long as you have other insurance available to you, and again, that would most likely be through a group plan because you were still working or your spouse was still working. It could go for, I signed somebody up a couple months ago. They decided to call it quits and they were in their 80s. So yeah, as long as you've got valid insurance, because you are going to have to go to the employer. And the employer that you're working for has got to fill out the paperwork that says you were working between the ages of 65 and whatever that date is. So I also had a couple weeks ago a missionary, and she didn't have a company that was supporting her and giving her, like a W-2 or even a 1099. So she's like, do I have to sign up for Part B? She had individual insurance that she had bought through like a buying group for missionaries. And when I did the research on that, they said she will have to sign up for Part B. She could not avoid it because she had no group employer to go to that could say, yes, she's on the group plan. There's 20 or more employees. We're going to waive it. So I think I answered the question, as long as you're still working.
Thank you, Nancy.
Yes. Okay. So what I would tell you here is a person that might be a higher income beneficiary, because they look back 2 years, might say, but you know what? I retired and my income came way down. They're looking at a year that I was still working. I need for them to look at the year prior, not 2 years prior. So I've helped a lot of people there. There are a couple of forms. Again, government's got a lot of them that will allow you to request an exception. So if you're married, there's 2 forms, 1 per person. If you're not, you fill it out, and basically it is an exception form that you're going to say, we would appreciate you revisiting this. And based on our income tax of last year, you can see that I'm no longer a higher income beneficiary. Would you please adjust it? And they're pretty good about that. You've got to have the documentation to be able to support it. So you'd have to have your income tax done for the prior year. And there again, there's a form that would allow you to request that. And everything, again, has to be submitted. You can't do the face-to-face. You would do a phone appointment to actually walk through all of that. So here's some of those deductibles I made reference to earlier. There's almost the $1,500. So you go to the hospital, you're admitted. You have to be an inpatient. You're there one night. They're going to charge you $1,484 if you do not have any kind of supplemental coverage. So if all you have is Part A and B, and there are some people that's all they have is A, B, and D for the drugs, they will pay $1,484, regardless of whether they're 1 day or 59 days. The benefit period for the Part A is a 60-day window. So if you're admitted and you're there a couple days, you fork over $1,484. If 3 months later you go back to the hospital, doesn't matter if it's the same condition or not, you're going to pay another $1,484. Again, this points out why people start to look for supplemental. They don't want to be on the hook. They don't want that kind of exposure. Part B, that's all the medical services. So now I'm not in the hospital, but I'm going to see my doctor. I need preventative services such as my mammogram and my diabetes test and so on and so forth. I need an ambulance ride. I need physical therapy. I need blood tests, so on and so forth. So those are billed under Part B of Medicare. First expense you're going to have is what's called a $203 deductible. So this deductible happens every year. A lot of the plans that are supplemental, they waive the $203, but just know that it's there. In the event, all you would do is Part A and Part B. You would be responsible for the first $203, which was this year. Last year it was $198, so it didn't go up that much. All of the preventative services that you know and love will come right across to you with Medicare Part B. And as long as you follow the timetables, most of these cost you nothing. Okay, there are a few that will be surprised. Shingle shot, for example, that is not considered a preventative service, and you do have to pay for that. I'll mention that a little bit later on. So the other deductible that you pay is under Part D, which is the prescription drug coverage. Again, it may or may not apply, but it's out there. So it is this year $445. So earlier today, I had a call from one of my clients, and I know she went to the store and they told her it was about $45. And she's thinking, wait a minute, Nancy told me my copay was $2. So I will talk to her about the fact that what she has is a annual deductible that she hasn't satisfied yet, where the cost of the drug was $45. And it fell in a particular tier on the plan that she has, and she did become subject to it. So she has just paid the almost $45 there, 44, 45. And if she goes back and gets that same medication, she's going to have to chip away at the $445. So we help you understand what that is. The point here is you could be subject to what's called an annual deductible, and then you would have copays like the $2 example I just made reference to. So we don't want you to be surprised. So if you're still in the hospital at day 61 now, they're going to charge you $371 a day. And if you're still there at day 91, very rare, they're going to charge you $742. Now, although I know this is an extreme exception, last year I had a client, double lung transplant, COVID. Husband couldn't even get in to see her. He called and he said, you know what, we're working on the 100th day. How's this going to work with her supplemental? I am happy to announce her supplemental covered it all. She had no out-of-pocket expense for all the 100 and some days that she was there. So it's going to make a difference on the kind of policy that you pick. You're going to know in terms of your health where you want to go. Do you want to be more of a risk taker? Maybe you are very healthy, or you might look at it and say, you know what, I have a condition of this, or I have a health history, family history of that. Maybe I want to protect myself in that way. This particular person knew that when she came aboard at age 65, she had underlying medical conditions. So she wanted the very best policy. And that's exactly what she bought. And maybe even in anticipation of needing the lung transplant. Skilled nursing is part of Part A. This is when you're in the hospital for about 3 days and they say, sorry, you can't go home. You're going to need some therapy, some occupational therapy. We're going to need to help you with your meds, so on and so forth. So the first 20 days are paid for by Medicare, and then anything after that you're on the hook for. And again, this is where your supplemental coverage is either going to pay for the whole thing, which this year it's $185.50 a day, or it's going to pay a portion of that. Part B, medical services. We talked about 20%. Keep in mind, everything has to be a Medicare eligible expense. So there are things they don't pay for. They don't pay for facelifts. You know, they don't pay for the eye refraction kinds of surgery, the LASIK surgery. So there's a number of things where they will say, no, we're not going to pay for that. So it always is about what they say they'll pay for, and that it has to be medically necessary. An unassigned claim is a claim where there might be some additional charges. And again, dependent upon your choice of supplemental, that can or it may or may not be a big deal. If it is something where they would charge above and beyond, this is where the doctor says, I didn't accept Medicare assignment. They can actually charge 15% of the difference. So Medicare says, we're going to reimburse $200. Doctor says, I didn't accept the Medicare assignment. My bill's $250. So the difference between $250 and $200 is $50. So 15% of the $50 is what they can come after you for if your policy, supplemental now, doesn't want to pick that up. So here's a couple of other items in terms of what's not covered here. So what we have is long-term care coverage. So long-term care typically is anything beyond 100 days. So Medicare might cover up to the 100. Your supplemental might cover up to the 100. And then anything after that, it is private pay, okay? And that's where carrier law comes into play. This is where they help you with Medicaid and so on and so forth. But long-term care is when you need custodial care. Could be in the nursing home, it could be in assisted living, it could be in your own home, but you need help with activities of daily living. The things that you take for granted, you can no longer do, and you might need help. Any kind of care outside the United States is not traditional Medicare. Doesn't mean that the supplemental isn't going to pick it up or help you bridge the gap there. But overall, no, Medicare is only in the 50 United States. You're going to see too that Medicare doesn't pick up dental, vision, and hearing aids, but a lot of the supplemental companies do. In fact, that's one of the selling features for the Medicare Advantage plan. Cosmetic surgery, not going to cover it. Acupuncture, they just introduced a little bit of coverage with acupuncture. That's brand new this year. Otherwise, it had always been excluded. And then, of course, any amounts over the Medicare approved amount, which is what we just talked about. Okay, so hopefully what we've done here is we've kind of given you an idea of what original Medicare is. That's Part A and that's Part B. Part A, zero premium, a lot of out-of-pocket. Part B, going to have a monthly premium, could be as low as $148.50 a month. If you're not collecting Social Security, they send you a quarterly bill. That's how you're going to pay them the Part B. You can set it up as either a credit card deduction and have it set up to a checking account, or you can send them the money, okay? If you're on Social Security, they're going to let you know they're going to deduct it from your Social Security benefit, and you've got nothing to say about it. So they typically will tell you your benefit was X, now your benefit is Y, and we're going to go ahead and start taking $148.50, and it will be effective the month that your coverage for Part A and or B starts, okay? So that's original Medicare. Now, when you're in the office with me, or even for right now, I'm going to refer to differentiating for the supplemental by saying I'm on the left side of the diagram and I'm on the right side of the diagram. So where you see that bar there, we're really talking about you have one of two options to pick for your supplemental. You cannot have both. First, everybody has to have A and B. We've set the stage for that. If I'm the person on the left-hand side, I have said I want to buy a separate Part B, and I want to go with what is called a supplement or a Medicare supplement, otherwise known as a Medigap. Now, this is where the terminology and the lingo gets a little bit goofy, because people will call the Advantage plan a supplement, and technically it is not. It's not supplementing A and B. It's replacing A and B. So stay with me. On the left-hand side, we have Part A and B. I got my red, white, and blue card in my wallet. I buy a Part D plan with the help of somebody like me, because there's about 40 different plans. It's going to be based on your medication mix, the pharmacy that you want to go to, so on and so forth. Your supplemental coverage at the very bottom of the page, this is going to be the coverage that's going to allow you to go to any doctor that accepts Medicare. There is no network. There is a network on the right side. It's called an HMO or a PPO or an LMNOP. But on the left-hand side, you get to pick the doctor anywhere in the United States that takes Medicare, or the hospital or the lab or the whatever. So you have a lot of flexibility in terms of where you go, because you can go anywhere in the United States. You don't pay anything more or less. So people that have homes elsewhere or do a lot of traveling, they're very comfortable with that side of things. You don't have virtually any out-of-pocket expense, but you pay for that. So this is the kind of person that says, I am more comfortable paying up front a higher premium. If you're 65, they start in the neighborhood of about $105, $110 a month. A man will pay slightly more than a woman. And the key here is when you first come aboard or are first eligible, so even the person who is still working will get one shot at no pre-existing conditions. So all the supplemental companies, insurance companies here, they will allow everybody in only the first time without medical questions. It's called guarantee issue. So like I mentioned earlier with the gal that had the lung transplant, she knew without a shadow of a doubt she had to have the supplemental coverage. She wanted the best possible coverage for her specific medical condition. So this person says, I'm okay paying more up front. I like the peace of mind in knowing. There will be times where, yeah, they pay the $100 a month, maybe never use the plan, but when they go to get the MRI, they don't pay anything. When they go to the specialist, they pay nothing. When they go to the hospital, they don't have the $1,400 out-of-pocket expense that I described earlier. So it's a very different approach, okay? They both work. You're the one that will have to help. You're the one that will need to decide what approach you're most comfortable with. My job is to show you the ins and outs, because a person that comes to see me, I will always show them both options, ask a lot of questions in an effort to understand what I think would be their best fit. So somebody that perhaps has a medical history, the better fit might be on the left-hand side, because I wouldn't want them to be surprised in 5 years when they thought they could automatically flip over to the Medicare supplement and find out now they were not allowed in. So that's definitely of consideration. There's probably about 25 different companies. They have plan letters. So some of you might have heard Medigap Plan F as in Frank. It no longer exists for anybody that's new to Medicare, born in 1955 or later, but it virtually covers any and all of the out-of-pocket. But there's a lot of other really good choices with a Medigap Plan G as in go or green. And the only out-of-pocket there is that $200 and some that I mentioned earlier. And these are things that we would go through. We'll show you the companies we represent. They're all A-rated companies. Now, once a year, you're going to get a rate increase. The good news is if you stay relatively healthy and you want us to revisit these down the road, we can, and it doesn't have to be during open enrollment. So I've got a couple right now that I'm tackling where the person has said it went up quite a bit, Nance. What do we do? And my question to them is, if you're still pretty healthy, we probably can replace what you have with a different Medigap company. And then they answer the medical questions. Now, it's not invasive. All it is a telephone call. They're not going to come into your house. They're not going to request medical records. They're just going to want to make sure that all the questions you've answered on the application are true and accurate. On the right-hand side, very popular plans, much more even, I think, in the last couple of years. These are the Medicare Advantage plans, otherwise known as Part C. So everything in Part A and Part B slides across and becomes Part C, but then they start to chip away at the out-of-pocket. So instead of the $1,400 that I showed you for Part A, they're going to have a hospital copay of probably on average in the neighborhood of about $300. So if you're there for 5 days, it might be written where you're going to pay the first 5. So 5 times 300 is 1,500. But if you're only there for 1 day, you pay 300 instead of 1,500. So they're going to look at parsing it out a little differently, but it will be to your benefit by picking up this particular plan, allowing them to be your one-stop shopping, because it's exactly that. You don't have 3 cards in your wallet. You really technically only need to carry your Medicare Advantage plan card. Maybe the first time you show the doctor your Medicare card because they need the ID number. But after that, it's going to go through the Medicare Advantage plan company. So those are companies like Priority Health, Blue Cross, Humana, WellCare, HAP, so on and so forth. And I represent the vast majority of those. So where we help you here is you want to make sure that your doctors are in the network. So we're going to do the analysis and let you know, yes, no, let's look at both these companies, whatever the case may be. Some people are okay switching doctors. Many people are not. The beauty of these are you have a low premium. So last year, I never saw Joe Namath on TV as many times as I did telling everybody about the zero premium. Yes, there are a lot of zero premium plans. It doesn't mean you don't pay the $148.50. Nobody escapes that. But yes, it is a zero premium, and you will get above and beyond the Part A and Part B deductibles and coinsurance that I showed you. And you get extra benefits. Those extra benefits are preventative dental, preventative vision, preventative hearing. They even now have over-the-counter benefits where you'll get X number of dollars on a quarterly basis. You'll be able to go to a Walmart or a Walgreens, show them your card, or even order online and be able to get vitamins and Pepto-Bismol and this, that, whatever. So they give you a stipend amount to work with. The beauty of it is the Part D is built in. So Many people don't take any prescriptions, or they take very inexpensive prescriptions, and they're like, wow, this is beautiful. Now, I'll also mention as an aside, if anybody uses GoodRx, you can keep using that. You can pick and choose where you want to purchase your Part D prescriptions. Nobody says you have to use the plan that you have for the Part D. You go where it's most cost effective. But back to the Advantage plan. So the Advantage plan, renewable once a year. The Part D is built in. You get all the extra benefits. Some of them are even starting to include transportation. Many of them also include the health club benefit through Silver Sneakers. Now, a lot of the clubs are not yet open, but they're starting to open. And some other goodies that go along with it. A lot of them even allow you to buy more dental and more vision with an upcharge between $25 and $30 a month. The beauty of the Medicare Advantage plan, their pricing, if you're relatively healthy, great. I got a zero premium plan. I go to the doctor, it could even be zero. If I went to the hospital, I might have $300, but that beats paying the $100 on the other side. But again, it really depends on the kind of person you are and the kind of coverage that you're going to be most at peace with, okay? The safeguard for anybody on the right-hand side is you have a maximum out of pocket. So every Advantage plan must have a maximum out of pocket stated amount. So most of those zero premium plans this year have maximum out of pockets in the neighborhood of about $5,300, $5,500. So what that means is all those copays, all those deductibles, with the exception of the prescriptions, will all go into the kitty. And if you were to ever spend $5,500 of your own money, and they send you a statement every month so you know exactly where you are, you will not have to pay another copay or deductible or out-of-pocket expense. So that's what the lower out-of-pocket comment is down here. It's called your maximum out-of-pocket. So I'm going to kind of go through this. I touched on it a little bit as I went left and I went right. But if we do talk on the phone or you come into the office, that's kind of how I look at things so that we can kind of keep the two separate. Everybody starts with A and B. The Medigap, private insurance company, plans are standardized. The most popular letter right now is G. F has been eliminated. The costs are going to vary by your age, your sex, the plan you pick, the company you pick, and where you live, okay? Every year you're going to get a rate increase. Again, what I saw last year there were people that were in their 80s that had Medigap. They loved the policy, but it was starting to get too expensive. So they said, I think it's time for me to try the Medicare Advantage plan. And that's exactly what they've done. Virtually no copays, no health screening questions when you first come aboard. Any doctor, any provider, you've got coverage within the United States, plus a little bit of limited international coverage. The Advantage plan companies, again, private insurance company, but it truly is one-stop shopping. They're going to manage all of it. They're going to tell you the copay. You're going to know what's what right up front. You still pay the Part B premium. There's the cost sharing, will vary from plan to plan, although most of them really are very similar if you put them side by side. Everybody's got a maximum out of pocket. You do have a network. You always want to double check that or let us do that for you. Most of them all include prescription drug coverage. The higher the tier, the more expensive the medication. So most of you, if you have meds today, tier 1 and tier 2 tend to be generics. Tier 3 and tier 4 tend to be brand name. The beauty of the Advantage plan is you do have coverage anywhere in the world as if it happened right in Western Michigan. So $300, I go to the hospital bill, I'm in Rome, Italy, and something happens, I got a $300 hospital bill. We talked about the added benefits and the fact that you could renew them on an annual basis. Prescription drug plan, just a little bit of an aside, this probably applies more to the person on the left. It was introduced in 2006. You have to add it with your Medigap. If you don't take any meds and you say, I'm not going to sign up for the prescription drug plan, you will have a penalty when you do want the plan. And it gets pretty expensive if you let it go for a long period of time. So what we do is we take the lowest price plan, We contact our clients that we know either don't take meds or they take very few. This year it was $6.90. So we called them and said, look, there's a brand new plan at $6.90. I think you still don't take any meds. Do you want to make a change? And most of them all did, like many made a change. So they might have went from $15 to $6.90, or they went from $26 to $6.90. That's the benefit of having an agent help you to make sure you get the most cost-effective plan. There are pharmacies too that are referred to as preferred and those that are standard. The preferred tend to be those that you and I are very familiar with, the big names, the Rite Aids, the Walgreens, the Meijer. The standard pharmacies tend to be more the mom and pops. They're going to be Hometown Pharmacy, K Pharmacy. So you want to make sure that you know if you go to that pharmacy, can we find a plan where maybe they would be considered preferred, or at least know that you're paying a little more because you have a standard pharmacy situation with your plan. These are the different stages of the drug coverage. I'm going to kind of skip past this other than to let you know the donut hole is not going away. Basically, in a nutshell, if you reach stage 2, that's a result of you spending over $4,100 in retail cost. So some of you know that the retail cost is a whole lot different than the copay. So if I use Eliquis as my example, it's about a $500 retail cost drug. If I had no insurance, they're going to charge me $500. That $500 goes into this coverage model or into stage 2. And you can see that 500 into 4,130 is about 8 months plus. I'm going to be in stage 3. Again, they send you notification of exactly where you are in relationship, but that's where that number is coming from. It's very goofy on how they do this. Congress put this together. They don't have to use it, but it is kind of a flow of how the drug goes through with the cost. If you end up in stage 3, you are in what we call the coverage gap or the donut hole. You pay 25% of the $500, or you pay $125. It's an annual scenario, so it goes January through December, and then everything resets again. If you make it into catastrophic, very few people do, fortunately, then you might pay $3.70 for your generic or $9.20 for your brand, whichever is greater. But there are some drugs that are thousands of dollars, and it doesn't take long for somebody to quick whip right through these stages here. So if you are somebody with more expensive drugs, we can help you kind of plan and anticipate and maybe even come up with some alternatives. I have a few clients that even go to Canada for their insulin and some of the other more expensive meds. You will all get an explanation of benefits. It's called an EOB. It will tell you more about your drug coverage and where you are in relationship to the donut hole. Shingrix. A lot of people were surprised that when they went in that they had to pay for it. And what it is it's a tier 3. And most of the tier 3s start out in the $40 range. But also when I talked about that annual deductible, most of the annual deductibles apply at tier 3. So I got lots of phone calls where people said, I just paid $185 for this shot. What gives? Well, that's the retail price. And they were satisfying the $445. So if you're not yet 65, go get your shingle shot and avoid it. Also, there are some drugs that are referred to as Part B medications. Those are drugs like chemotherapy and drugs for arthritis. And they're referred to as an infusion or an injectable drug, typically given in a center, not necessarily in a doctor's office, but sometimes. So you want to be in the know on those as far as where is it going to fall. Again, I met with somebody not too long ago, and she was thrilled to find out that her medication through cancer and hematology was a Part B. So she's going with a Medigap, and they're going to pick it all up. So she doesn't have to worry about the donut hole. It becomes a non-issue. You can revisit your Medigap plan anytime. It's not subject to that October through December. And a reminder to stop contributing to an HSA if you have any portion of Medicare, either because they gave it to you or because you asked for it. Once in a while, somebody will say, I never wanted my Part A and my Part B. I disenrolled from Part B, but they won't take Part A back. And that is correct. They won't. So you cannot disenroll from Part A if they've already given it to you. Their logic is there's no premium. So what's the downside to it? Well, the downside is you can't contribute to the HSA. COVID-19, those tests that we're getting with vaccinations or any kind of lab tests, they're all covered. As you know, telehealth has become real big. Again, most of the plans do not charge for any kind of telehealth visit. For anybody that takes insulin, with the prior administration, they did make arrangements for some of the insulins, not all of them, Lantus, Toujeo, some of the others. It is a $35 copay. I've heard that could get reversed. I certainly hope not, because that was a real breath of fresh air to any diabetic that was on insulin. We talked already kind of about the tiers, so I'm not going to spend any more time on that. And we're kind of coming to a close, so I've taken a couple extra minutes here. So these are some valuable resources for you in addition to us. There is a wonderful website called Medicare.gov. The SSA.gov website is where you can learn more about Social Security or where you would enroll in your Medicare Part A and or B. Once you're up and running with Medicare, you can actually sign in and see all your claims, and you can look at your medications and a variety of other things. Again, they're really pushing everybody to do things online and less paper and so on and so forth. You're going to all get, if you haven't already, because you're on Medicare, the Medicare and You Red, White, and Blue book comes out every October. It's also available online. It is a very good resource. There is a choosing a Medigap policy guide, both guides put together by the government. Carrier websites are another good resource for you. I'm sure a lot of you have friends that have Priority Health or Blue Cross. Go out to the websites and look around. They've got some good tools out there, or give us a call. And then certainly talk to your friends and your relatives. Find out what they say. I will just caution you. A lot of people will say, wow, I can't believe that you pay $100 some in your premium. And that would be on the left side. And the only word there is to make sure that you know, are they talking about a Medicare Advantage plan, or are they talking about a Medigap? Because my response to them would be, you're right, I do pay $100, but I don't pay anything to go to the hospital. What do you pay to go to the hospital? And they do pay. So although the premium is zero, and there may be some other zeros there to go see the primary care doctor, not so much specialists or any other services there. If you go to the hospital, that tends to be the more expensive part. And remember, with an Advantage plan, you do pay every time you go. So if you only go a couple times a year, it works beautifully. But if you need a lot of physical therapy, or if you need MRIs and you need CAT scans, or you're being treated for cancer, then you might want to consider a Medigap, or at least do a comparison between the two and then make a decision based on that. So our offer to you is this: we never charge for any type of conversation, whether it be in the office or over the phone. We will give you the personalized attention and guidance that most people still want. You can certainly try to go on your own. I can tell you the rates are no different than what I would quote you, and you get the personalized service now as well as in the future. And again, we will meet you wherever you want in terms of your comfortability, given the current pandemic situation here. So what we'll do is we will do the analysis, we'll verify the doctors, we'll ask you for a prescription drug list so that we can do our homework in advance. We're going to try to help you minimize the donut hole if you're a candidate for that. And we're always going to recommend the most cost-effective plan. And we're going to do a lot of listening, and we're going to answer all your questions. Here's our website, nancycourser.com. Here's our phone number. We're option number 2. And again, if you want me to send you anything, I'll make sure that you have all this contact information as well. Certainly Chris has it too. And there are email addresses.